Dr. Leisle, I know that, you have talked to me and you have mentioned how important it is not to have gum disease, not just for the individual person, but also, I think you mentioned something about when ladies are pregnant, it starts, I told you, when should people go to the dentist with their newborn child? And you said before the child came in, simply because if a mom to be has, for instance, gum disease, that means she's infecting that body. That means she is transferring that disease right to the baby. And apparently, around the world, there is total data out there that moms with gum disease are prone to have premature births and underweight babies. In fact, in California, where we both live, there was one lady who had a stillborn baby because they found the yellow, reddish, ugly pus of the gums in the placenta. Now, that is, of course, one case we're aware of, extreme, and all that stuff. But if that type of stuff can happen, premature babies and stuff, I mean, what else can happen in terms of lowered immune system, more diet and kidney failure and all that type of stuff? In any case, what do you have to say about a lady being pregnant, maintaining her gum? You think it's important?
Definitely. For her own well-being, the child's well-being, for the whole family. Once again, as I mentioned before, good habits will give good results. Bad habits will give bad results. I mean, that seems really simple, but that's very true in all aspects of our life. So in this regard, if a mom doesn't take care of her own mouth, and then what's going to go? The blood system. You mentioned this one case. I'm sure there's more cases than that. It's just that we haven't asked the right questions all the time on autopsies or on stillborn births. And then, so if you don't ask the right question, you're not going to get the answer, the complete answer. Mm-hmm. So anyway, as far as the beforehand, yes, before having the baby, the parent mother needs to take care of her health with vitamins, prenatal vitamins and her own oral hygiene. Not to mention that after having the baby, it's still just as important taking care of your health because, for example, a child is born with the bacteria that cause cavities in the mouth. A child doesn't have them in their mouth when they're born. We give it to them. The bacteria have been found that they're not in the mouth when a child comes out of the womb. But what happens is the mother or the father, they take, like when they're testing the food with the teaspoon, and they're making sure it's not too hot, or they take the nipple of the bottle, make sure the milk's not too hot if they do bottle like that, and then they pass it to their child, and they just transfer those bacteria to their child. Or the pacifier or something falls on the floor, and they lick it and they wipe it off, but they didn't wipe off all the bacteria, and they transfer those to the child. So besides that, if a person the mother has poor oral hygiene, or the father has poor oral hygiene, they're transferring those bacteria that are part of that poor oral hygiene to their child. And when they taste that food and all that. So anyway, so there's many ways that we don't even think of. Pardon me?
Kissing the baby.
Yeah, kissing the baby, but especially in the transferring of utensils and that kind of thing. Another way that cold sore virus is passed is that way. But that's another subject. Anyway, so that's very important that the parent gets their oral hygiene well under control. They don't have the bleeding gums. They're taking care of their mouth. So then the child's going to have that same thing. Learning good habits, but not also passing bad things to them.
Right. And, it looks to me like having a gum disease while being pregnant, is almost like you get the same results than a mom who is on drugs while being pregnant. The baby comes out drugged in the first place. And, if you have a gum disease, which is by definition an infection, infects the rest, whatever is around.
The body.
So the body will be infected, the baby will be infected, and neither one, mom or baby, want to have a lowered immune system during pregnancy or right after. I mean, so it's just you're drugging the baby. Is if you have
with bad bacteria.
Yeah. Mm-hmm. So not a good thing. So if your gums are bleeding and if you know that you're about to be pregnant or are pregnant, get it fixed.
Yes, definitely.
All right. So you agree with that? Good. Thanks, Dr. Leisle.
You're very welcome.